7 signs of a heart attack that occurred 1 month earlier. Do you know that a heart attack occurs in the United States every 40 seconds? Heart attacks have increased noticeably over the last 10 years, especially in women and those under 40. It may surprise you to learn that 1 in 5 women could have a heart attack. International health authorities report that cardiovascular illnesses kill more than 17 million people worldwide each year. That is, almost 30 people every minute, more than cancer and vehicle accidents combined. These illnesses are sneaky since they don't always show symptoms. Often, we don't realize there is a threat until it's much too late. This is mostly because people are unaware of the crucial early warning indicators that precede a heart attack. We'll talk about the causes of the alarming rise in heart attack cases today, as well as how and why younger people, men and women alike, are being affected, even if they have never had a heart attack before. Number 1. As a matter of fact, in the days preceding their heart attack, as many as 30% of those who have had one reported having this experience. What distinguishes this from typical sweating, though? Sweating that is not connected to heat or physical exertion occurs gradually and differs greatly from the quick appearance of cold sweats associated with heart problems. It's cold and sticky, and frequently accompanied by a shiver feeling throughout the body or on the forehead. You may have an abrupt pallor in your skin. This is a sporadic symptom that goes away on its own in a matter of minutes. It can happen at any time, whether you're eating, sleeping, or engaging in any regular activity. Number 2. Breathlessness or exhaustion. This is a serious symptom. Remarkably, 70% of female heart attack survivors stated they felt breathless or exhausted in the hours or days before the attack. This is not your average exhaustion. It's more akin to the flu's fatigue, but without the fever, cough, or sore throat that go along with it. You should be concerned if you experience such severe weakness or muscle exhaustion, particularly if it hasn't happened before within the prior 30 days. If, after performing relatively light exercise, such as walking a block or ascending stairs, you find yourself abruptly out of breath, or if your level of weariness seems abnormally high given your exertion, pay close attention. These symptoms would point to artery blockages, which are a warning of impending heart attack. Number 3. Jaw ache. You need to pay close attention to this one. Discomfort in your jaw, especially on the left side, may be an indication of a heart problem, possibly warning of an imminent heart attack, just as tingling in your leg may indicate spinal problems or shoulder discomfort, may be related to your liver or gallbladder. Our bodies are wired in a way that causes this occurrence. Our organs form, with nerves originating from different sections of the body, while we develop in the womb. As a result, as adults, our brains occasionally misidentify the origin of pain. Thus, take into consideration that you may have a warning sign if you have unusual or prolonged jaw pain, particularly if it is on the left side. It's important to recognize that discomfort in one location may occasionally be a sign of a more significant problem elsewhere. Though there are numerous reasons for jaw pain, it's important to remember not to ignore it if it's accompanied by other heart attack symptoms, or if you have risk factors. It's always best to be safe and get help from a cardiologist right away, particularly if it's combined with the other symptoms I'll be discussing. Number 4. Discomfort in the digestive system. This particular symptom is more common in older adults and women. This isn't just ordinary stomach ache, rather, it's a sensation that may be mistaken for gastritis. You may experience pain when walking or exerting yourself, as well as bloating in your stomach during or after meals. These are the times when you really need to think about the possibility that your heart, not your stomach, could be the real cause, particularly if you are in the high-risk category for atherosclerosis. You should exercise extra caution if you smoke, are over 50, although it can happen at any age, have diabetes, high blood pressure, obesity, especially excess visceral fat, diabetes, or regularly breathe in secondhand smoke. Please take these indicators seriously if they align with your experiences, particularly if you have any of the risk factors listed. They can be the first indication that a heart attack is about to occur that your body is sending you. Your life and your heart may be saved if you receive treatment early. These symptoms should not be taken lightly. Number 5. Back discomfort. Pain in the area of the lower neck, particularly on the left side, or around the scapula, may have been an early warning sign of a heart attack or a problem with the aorta artery, which is one of the biggest arteries in the body. It's simple to write this off as simple muscle soreness. But be careful here. Positional adjustments or self-massage may help relieve the pain. but they may also be an indication of something more serious. This type of pain is different from ordinary muscular soreness in that it lasts longer and is not relieved by common treatments. Nearly every area of the body receives blood supply via the aorta. Illnesses that weaken its wall can cause tears or ulcers to occur. Number 6. Tingling in the left arm and hand. Have you had any little pain or numbness in your left arm or hand over the last month, particularly when walking or ascending stairs? If so, consider it to be a possible red flag. Although a number of health issues might result in this kind of numbness, it's important to take the situation into account. It's time to act if this is a new symptom for you. If you have the previously specified heart disease risk factors, and if there isn't another plausible reason for this abrupt shift, seeking advice from a cardiologist could be essential if you are at risk for cardiac issues. Number 7. Dizziness. Watch alert for unexpected periods of low blood pressure, symptoms of faintness, or sudden dizziness. It is important to pay attention to these symptoms, particularly if they are new and happen when you're physically exerting yourself, walking a block, climbing stairs, or even eating. A cardiac catheterization is frequently required for people who have these symptoms and are subsequently discovered to have serious cardiac problems. This diagnostic process, which uses contrast to make the coronary arteries visible, frequently shows that the occlusion is almost fully formed. Why do people get heart attacks? It all begins with the heart's essential function of pumping blood that is rich in nutrients and oxygen to every part of the body, including the heart muscle. This blood must be delivered straight to the heart via the coronary arteries, which are nested within the walls of the heart. Blockage of these vital arteries results in acute coronary syndrome, which is another name for a heart attack. A number of things, such as inflammation in the artery walls, calcium deposits, and cholesterol accumulation, can cause this blockage and prevent blood from flowing freely. The main cause of these blockages is frequently atherosclerosis, a disorder in which the arteries constrict and stiffen. The silent aspect of atherosclerosis, which frequently shows no symptoms until it's too late, makes it risky.